Let's start with the concurrent session. So I'm very glad to introduce Dr. Bruno Marchal. He's from Institute of Tropical Medicine. His doctoral research was on the influence of health workforce management practices on performance of hospitals in Ghana and Tanzania, using the realist evaluation as the main methodology. He is currently working mainly on the strategic management of healthcare organization, stewardship, and evaluation of complex issues in health, and heading the Health Services Organization Unit at ITM. So I welcome Dr. Bruno Marchal and ask you to request you to facilitate the session.
All welcome to one of the last sessions of today, at least one of the last parallel sessions. What I would like to do very briefly is take a bit of time to deconstruct the title of this session, which is linking research, policy, and practice. And it seems to be a very simple kind of thing. It's as if you produce research, it leads to evidence, and the evidence is then taken up into policy-making processes and into practices. But of course, there's a lot of things that can be wrong. You might think it's a linear relationship. In fact, I don't think many of you still think it's a linear relationship. But so that made me go back a bit to ask a number of questions that some of the presenters in the next session actually will talk about. What is research and what is good research, and when does it produce evidence, and what is good evidence? And is evidence actually used in policy making, or what kind of evidence do we need for good policy making? And then, of course, the last question is a question that has not been discussed much yet, I think, during the conference, but is it really possible to produce appropriate evidence for the very complex issues that are perhaps underlying the most important health problems in our kind of countries? Now, it made me think of Karel Weiss, who was a great political scientist who wrote about policy making and decision making a long time ago. Quite interesting paper came from the late 1980s. And it has an advantage that, Karel Weiss has the advantage that she also talked about theory-driven research, so I'll come back to that one later. So in this paper, she kind of started looking at why it is that research is not being utilized. And she found a number of models. So the very simple one is this one. It's the one which is reflected in the title. It's like, produce research that leads to evidence, and then decision-making will be better. We all know that that is not happening. But in the 1950s and 60s, that was underlying most of the policy formulation and policy implementation theories. And then came on the more advanced model perhaps. Decision makers will be confronted with problems, so they will need evidence, and they will actually commission research. Getting the results of that research, that will actually then improve the decision-making process. We also know that that one is not really happening. I mean, we had lots of discussions during yesterday actually and today, showing that this is not always the case. Then she found the interactive model, and I think again a number of discussions, even this morning, are showing that there are these kind of spaghetti diagrams where lots of actors are interacting with each other, and it leads to information, to evidence, to knowledge, to opinions, to conjectures, to judgments, and all that somehow finds its way into policy. So that is what she calls the interactive model. And then the political model is, again, back to the linear one, but then saying, look, sometimes research is led by policy. So this is not research-informed policymaking, but policy-informed research, where selective use is made of evidence as it suits the decision makers. And I think we also know a number of examples of this kind of processes. And then finally, I think she got a bit disillusioned with all these approaches, and she said, okay, is perhaps the best we can achieve not just a kind of an enlightenment of actors, whereby research contributes to changing mindsets and changing viewpoints, and slowly it filters into the decision-making process. So this is a very indirect way of how research could influence decision-making. But it might be important because it might lead to putting particular policy issues on the agenda and creating actually a pressure to do something about it. So what she says is, okay, there's no one model that explains everything, and I think it is because policymaking, to a large extent, and at least when it is dealing with very important societal issues, it's a complex issue. Complex because of the many actors that are involved and the very messy relationships between all these different kinds of actors. So I think she got a bit disillusioned about the impact of research and evidence into the policymaking process, and I think it's an important point to the extent that from the researcher's point of view, we really think that evidence is the most important driver of the decision-making process, and we should turn around the perspectives. We should look at how decision-making is actually being done. So let me jump to the second part. That is how theory-driven evaluation and a number of other approaches could be used to lead to better decision-making by involving the different kinds of actors. You remember the spaghetti diagram with all the kinds of actors. There should be ways, there are actually ways, whereby you can engage those actors in a much more systematic way and contribute to building evidence, again, in a much more systematic way. Participatory action research is one of those potential possibilities. There are a number of other approaches, but I'll focus on the theory-driven approaches. And why is that? Well, let's say the people who kind of invented that approach kind of noticed this huge rise of evidence-based policymaking. And of course, that came in the wake of the evidence-based medicine school of thinking. That was hugely successful, or at least even here we're doubting now that it has perhaps reached its limits. But the evidence-based decision movement really influenced some people to say, look, we need all policies to be based on evidence. Now, that led then to the use of systematic reviews and meta-analysis as a way of synthesizing evidence and kind of summarizing the best available data to guide the decision-making. And of course, plenty of impact studies, cost-effectiveness analysis. This is kind of the things you all know very well. The point is, you might say this makes sense. But I think there's a different perspective, and that's the realist perspective. There are other schools that follow the same lines. I'm just picking out one school here. What the people who invented this thing say is, okay, what really matters is, of course, that you know whether the invention worked. But what's perhaps more important is that you figure out how it worked and where it worked, in what kind of conditions. So what kind of conditions you need to make it work. And did it really work for all of the people you targeted? So that's about coverage. And how long did it work and why? So this is a much more kind of fine-grained analysis that is required. But if this kind of research can produce this kind of information, it may be more useful to decision makers who then could take up that evidence and say, look, if this worked there, but you need that kind of conditions for this kind of people to actually do it, then it might not work in my situation. So it allows people to make a much more nuanced decision. And that kind of information, of course, is filtered out when you look at meta-analysis and impact evaluations, where because of standard methodological criteria, context is kind of filtered out and you aggregate data. So realist is looking at how things work, and it's quite important to see the viewpoint that you don't want to replicate policies, you don't want to scale up programs. What you want is actually to achieve the good results. And to achieve the good results, you need to figure out how things work. So it's much more about understanding how things work and why, than to just prove that it worked. And the central part of the realist thinking is it's that people take up programs. So it's not the programs or policies that change things, but people. And what the best thing, let's say, a program could do is perhaps trigger a mechanism. That's a principle of change, a driver of change. That will work for some people, perhaps not for others. In some contexts, but not for others neither. And so it's about finding out what works when and how. So we go away from this kind of variable-oriented analysis to causation to a much more configurational or case-based approach, which is much richer in its perspective. Then you might say, of course, okay, but how is realist evaluation then different from case studies, where we go into a particular case, we try to understand the fine-grained kind of analysis, let's say the causational relationships between context and people and interventions. The difference is that realist starts from theory. Theory is not a big theory, it's a theory about what makes things change. So we call it program theory. It's middle range theory. And what it actually is what people think about intervention or about a policy and how it will work. So these are your theories, the policymakers' theories, the scientific theories, or the scientists' theories, but they are combined with existing evidence and the existing concepts. Because don't make mistakes, everything we're looking at has already somehow been studied elsewhere. Simply, usually we don't know about it and we don't read it about it. And that's probably to a large extent because we stick within our disciplinary kind of silos. The beauty of this kind of thinking is that if you conceive a program theory by involving the stakeholders, by looking at the current evidence, then you come to something that can be tested. So it's not just a hypothesis that you fling out and you propose to policymakers. It's something that actually can be tested empirically, and then you can use both quantitative and qualitative methods. So to conclude, I would say research can definitely contribute to better policymaking and to better practice if you engage with the different kinds of stakeholders and actors that are involved in the process, from the bottom to the top and back. Not only, in fact, at very local evaluation level, but also during the policy formulation level. And the thing is, of course, I mean, I don't see Prashant in the room, I'm not sure if he's here, but Prashant did kind of a scanning, Prashant of IPH did a scan of the literature and of the big evaluation that happened in India over the last 5 years or 6 years, and he found very little of this kind of approaches. So you see basically lots of cost-effectiveness analysis, lots of impact evaluations, lots of quantitative studies that try to influence policymaking, but not the more fine-grained kind of analysis of what actually causes change. And I think there's definitely need for that.